Okay, well, welcome to our parent webinar series. And today we'll talk about how to get the most out of your ABA therapy services. And really, I want to focus on how to collaboration with your provider. My name is Fumi Honer. I am a VP of Clinical Quality and Outcomes and Research from Bierman Autism Centers. Oops, there it is. So before we start, your participation is strongly encouraged. I'm not sure how many parents are able to join tonight. Last time when we started in a very small number, and then over time we had a lot more attendance and participation. So please feel free to stop me and ask questions or make a comments. Make this content relatable to you. And really, here are your communication options during the training. I apologize. I don't know if you can hear, there's a background noise. So there are two options. You can see the bottom. If you hover over your bar, you see a chat and raise hands, and there's a Q&A. You can directly type your questions if you prefer that way, or you can raise hand, and I will do my best to monitor that as I go through, and then we can pause and then maybe expand questions as well. Okay, so intensive ABA therapy, ever since the autism mandate, the law has passed, there are more and more states, and now in 2022, all states require autism therapy to be covered by the medical insurance, which is a significant change since compared to when I started, which is back in 2000, early 2000. However, because that therapy itself is a relatively newer therapy, there are a lot of misconception or confusion related to ABA therapy, what the structure is supposed to be, who does what the parents are supposed to expect from the therapy, and who they should be talking to. As you know, there are behavior technicians and the behavior analyst, the BCBA, and sometimes you might see clinical director who is in charge of the entire center or entire region. You might have a home-based therapy. Then in that case, you might have a regional director or somebody is in charge of that region. Or you might also see some kind of office manager, scheduler, practice manager type of person that help you administrative related things for billing. So you might have a lot of people that you contact and you're not sure who you should direct specific question to. So I'm really hoping that this training, this webinar will help you understand what the ABA therapy structure, how the ABA therapy therapy is structured, and also the core principles of ABA and how you can get the most out of it. So when you hear collaboration with service provider, you might think that, well, aren't they supposed to know what they're doing? Why do I have to collaborate? But think about this way, when you are working or when you are going to see your doctor because you are experiencing some symptoms or you have a complaint about, for example, back pain, they will be asking you a series of questions. Describe your symptoms. How much is it bothering you? Is it impacting your daily activities? Can you sleep? Can you work? Can you attend to your family members' needs? So after you answering those questions, they might give you some kind of treatment options, and you have to let them know how comfortable you are for those options. Then they will make a recommendation what you should do based on that. So that is a good collaboration. They will go through a series of questions. You respond, you prioritize, you also say, I prefer this way over that way. And then they make ultimate decisions. And similar to hair salon too, when you go to a hair salon, you have to tell them what you're looking for and they will make it happen. Or they might ask some questions to make sure they understand or what they are planning to do is aligning with what you're looking for. Same thing with the teachers. When it comes to a teacher who is providing educational services for your children, they will do the assessments, they will report the scores, or they will tell you how the kids are doing at school, and they will try to collaborate. Maybe they will send them some homework for you to work on, or to observe how they are, how independent they are to complete that kind of task. So you can see a little bit of what they can do in a school setting. So caregiver involvement in ABA therapy. Sorry, I'm having difficulty with. There's a delay, apologize. So we BCBA work with one of the most vulnerable population, as you know. Many kids with autism have a very significant language delays. And as you know, many of them cannot report to you what they did, what they had fun with, what they didn't like. It is very important to, and there are a lot of things that they do that are kind of appropriate or not appropriate. There is a lot of fine lines that we have to draw and decide, okay, so a lot of kids without autism, they will cry, they will whine, they will protest. That is very, very normal. But when you are working with the kids who's not clearly able to communicate what they don't like and what they like to get out of, we have to really decide, okay, is tantrum in 3 minutes, it's too long? Do we really need to intervene it behaviorally? Or do the kids cannot follow X, Y, and Z safety related instructions? Is it really a problematic, or is it still somehow manageable because he or she is pretty responsive to redirection? So what should be our primary treatment goals be? These are the conversations as a BCBA. We are expert in assessing the kids' skills and analyzing, observing, identifying functions, what they can do, what they cannot do, what they could do with some assistance, but not hand over hand prompt all the way. So we're really good at that, but we are not an expert for the specific individual. So what that means is it's very important for us to collaborate with the caregivers so we can hear what you think that they are able to do. How would I know as a clinician where the boundaries are? If he reacts this way, that's when you know that you need to stop because he really doesn't like that. Or yes, there's going to be some instances with or without autism, they're going to complain about it, they're going to whine, or they might do like, I don't want to. Is it really appropriate based on the age, or is it really inappropriate that we need to tackle and address behavior using behavioral strategies? These are the decisions that we really need a caregiver's input so we can make decisions together. And also, we don't want to confuse the kids by implementing inconsistent strategies between home and center. So we want to be on the same page with the caregiver. When I say caregiver, not just the parents, anyone who is in a child's life. So that includes the grandma and grandpa or neighbors or the teacher. So we do a lot of make sure that we are on the same page, and BCBA do have a responsibility to correspond to all the parties who are, all the individuals who are in a child's life to make sure that we can facilitate their language, facilitate their independence in a similar manner. And I always like to put this out there so the parents do know, right? Parents do have a right to effective behavioral treatment. What that means is the most effective treatment procedure available. They have a right to them. So the individual is entitled to effective and scientifically validated treatment. In turn, behavior analyst has an obligation to use only those procedures and that is demonstrated by research to be effective. So if you are receiving ABA therapy and the BCBA says, oh, we are working on the toileting skills, feeding, addressing some problem behavior by teaching functional communication skills, that has to be, you have to see some improvement. And if you don't see them, you have a right to address your concern and say, hey, you said that you've been working on it last 6 months. I don't see that at home, or I still see a lot of tantrum when I take him to a store. And that's exactly the same since I started, which is 6 months ago. What can you do? You have a right to address your concern and talk about it. And BCBAs do have a responsibility. And then it is also covered by medical insurance that we have a those services to collaborate with the caregivers in home setting, even though they might not be receiving in-home ABA therapy. ABA should be providing services to generalize those skills that kids are learning in a center, even though they might be just receiving center services. But we have an obligation to facilitate generalization across all the environment. So if you have any concerns that are in a specific setting or a specific individual that is outside of a therapy center environment, you have a right to talk about it and receive some kind of a strategies or treatment, or maybe additional training from the BCBA, so you can effectively handle the situation, or teach the child to use some kind of functional communication skills in the environment or with the individual. We'll talk about more in terms of family empowerment in a little bit. And lastly, in a very original ABA study that happened in 1987 at the UCLA, I don't know if some of you heard of that study, but this is the very original study that 47% of participants who received intensive ABA therapy after several years, I believe it's 3 years or so, intensive therapy, they lost the diagnosis. The definition of losing diagnosis is still a little bit of a controversial, and also, but this study has been replicated so many times, and the results have been consistent, and therefore the medical insurance started covering ABA therapy for autism treatment. But going back, yes, I did talk about the kids who are receiving intensive therapy services, which is 30 to 40 hours a week of therapy. But what they commonly don't talk about is the parents who participated in parents of the children who participated in the study. They also worked as a part of the treatment team, and that happened throughout the intervention. And they were extensively trained in the treatment procedure, so the treatment could take place almost all subjects or so the children's waking hours, 365 days a year. It sounds very intensive, but when you practice it, you will know what the kids like. We talk about, I'm sure you heard about reinforcer. We really, once you get used to conducting or using some ABA techniques, you have to know what the kid is motivated for, which if you're parents, it might come in easy that you know what the kid likes and what the kid doesn't like. So you use that to really encourage, and then you're gonna reward them or reinforce the appropriate behavior if you wanna see that more of that behavior in the future. So there are a lot of basic techniques that parents can easily use at home, but those things needs to be accomplished during the individual one-on-one collaboration with the provider, so they can customize instead of using a cookie cutter approach or parent training curriculum and send it to you, and you kind of have to go through that. That format might work, but really lacks the individualization. So it is very important for you to directly communicate with the parent, the provider, and talk what works and what doesn't work and what you are looking for. So before we go deeper in what ABA therapy does and how to problem solve, let's talk about the ABA therapy structure a little bit. So you've probably seen this, the BCBA, the board certified behavior analyst, is in the top of the pyramid, and they are in charge of, oh, there we go. So as you can see on the left top corner, that BCBAs are in charge of conducting assessments. They're the one developing skill acquisition programs. So all the skills that are not yet in a kid's skill repertoire, so that therefore they are targeting to help the skill emerge and facilitate, and eventually the skills should be generalized across the settings. And also creating a behavior intervention plan that includes some proactive strategies, what you can do so behavior doesn't happen, or sometimes behavior happens unexpectedly, then how to handle it so the kid will learn the behavior, it's not reinforcing, meaning that behavior doesn't make sense to them. So they no longer do that kind of behavior, or then it's very important for you to teach what they can do instead. So they don't have to throw 10-minute temper tantrum, but they can do something that is easy and more functional, and they have access to what they're looking for right away instead of throwing a 10-minute tantrum. So we teach the functional communication skills or replacement behavior, usually at the same time, so that once the tantrum or unwanted behavior occurs, the parents and also the clinicians know how to react to that and what to teach instead, so the kid doesn't have to engage in those behaviors. So that's called the behavior intervention strategies. And they are also, BCBAs are also in charge of training and supervising all the behavior technicians. And they're the one coordinating or corresponding with other service provider, which could be speech language pathologist or occupational therapist. On the other hand, there are behavior technicians. For your child's ABA therapy team, you might have a 1 or 2 or maybe 3 or 4, depending on how things are structured or how many number of hours that your child is receiving. Or sometimes if your child is really working on generalization skills because they are getting ready to transition to school setting, that means that child has to be ready to use that skills that they learned with so many different people. So we don't want to really stick to just 1 or 2 behavior technicians and the child all the time. We really want to push them to start practicing skills that they can do outside of that. So depending on what they're targeting, but the behavior technicians are the one who implements program and also the intervention. Hold on 1 second, I'm sorry. Sorry about that. So the behavior technicians are the one implementing programs and the intervention and take the child data during the therapy, because they are the one directly working with your child. And how they're working is they're implementing programs or behavior strategies the BCBA creates, and the BCBA trains them to implement it so the behavior technicians can implement the programs and strategies. And they also take data and they report back to BCBA if there are any issues or a child is making progress or isn't making progress. So this model really is similar to if you go to the doctor's office a medical doctor and those nurses who are taking the blood pressure or checking in, asking your symptom, writing it down. So all the symptoms that you're presenting, they might take notes for the medical doctor to maybe review right before they do the little final exam, or make a recommendation what kind of medicine you should take or what you need to do. So the behavior technicians are like nurses, that they do all the hard work of implementing things, taking data. And then the behavior BCBAs are the one making sure whatever they plan for that specific child is implemented in a consistent manner, not this BT is doing this way and this behavior technician is doing that way. BCBAs are responsible for making sure everybody's on the same page, everybody's implementing procedure in a way that they programmed, and the data that behavior technicians are taking are heading, trending towards the desirable direction. So meaning that they're working on the behavior that they want to see more of, making sure that when they are taking data and they are graphing, that behaviors are going up. And when they are working on the behaviors to decrease over time, and the behavior technicians take data and making sure that data are trending downward. So it's going away. Oops. And there are three components within ABA therapy. First part is assessment. So when we talk about assessment, that includes direct assessment and indirect assessment. Direct assessment usually is observation of the child. Sometimes that observation happens in a complete natural environment, or we might contrive a situation so the child has to ask for something or get some assistance from an adult to get what they want. Or when I say, oh, okay, playing with the train track is all done, let's go read a book. So when I change the activity, how are they going to react to that? So we might contrive some situation to see how much the kid is able to adapt to the new situation, or communicate what they want, or communicate what they see, how they feel. So that kind of goes under the assessment. And there's a therapy. That's a big, huge part of it. It's a direct therapy by behavior technicians, and the BCBA supervise all the activities that behavior technicians complete. And then the last part is the caregiver guidance. So that is all the fine tuning happens during that time. Like I said, we are expert in conducting assessments and implementing procedures, but how we decide which behaviors to tackle, what skills to teach, how we're going to teach it, that's another word for individualization. We need a caregiver to help us so we can work together to fine tune those curriculum or programs that we are developing. So assessments, like I talked about, direct observation of the child. Indirect assessment is typically that involves a lot of questionnaires or interview with the parents or the caregivers. And as I mentioned earlier, the behavior technicians provide a therapy. So that's a direct implementation of behavioral protocols that BCBA creates. And BCBA provides ongoing modification and updates. So when it comes to caregiver guidance, so the last component within the ABA therapy, I really want to highlight the transparency. So that means that BCBAs should be communicating with you all the progress the kid is making. And also, if they are planning new goals or new intervention that they are planning, they need to be communicating that with you to get your consent or thoughts. If you have tried something similar and you're a little hesitant about that kind of strategies, of course, we want to hear that. And of course, you should be talking about that too. And we want to make sure that you feel comfortable with the interventions that we are proposing. So it is very important for us to communicate how the kid is doing with us and what what BCBA is planning to do in the future. So you have an opportunity to say yes and also give you some thoughts. And then the last part, empowerment. I cannot emphasize this part enough. Facilitating generalization of the child's skills. And also the second part, supporting caregivers or parents to feel confident about managing the child's behavior outside of a therapy session. And like I mentioned earlier, ABA therapy is historically and originally, it's short-term, extremely intensive therapy. What happens after is that, so during the intensive therapy, kids learn all the skills that they need to learn so they can independently learn from school, from a family members, or from their peers, how they're playing, how they're negotiating, how they're communicating each other, what kind of stuff that they like, how they make friends. Those are the things that they learn in a natural environment independently. So, but for them to do that independently in their natural environment, they need to have so many skills that they have to learn. And a lot of kids with autism, those skills need to be explicitly taught so they can practice it so many times, and BCBA can systematically program so that skills are generalized over time. And what we want the caregivers to do is to monitor the generalization, whether it's happening or not. And also, when that's happening, we want the parents to maybe deliver reinforcer, meaning that, acknowledge, recognize that and say, good job, or give them a high five, maybe a hug and kisses, whatever works between your child and the parents. But there has to be some incentives for the kids to start practicing those skills. Probably not for the long term, because once you get in the habit, it's going to come in easy for them, and they will come in contact with what happens. So, oh, when I do this, my mom says a good job and I don't have to do X, Y, and Z. Or when I do this at school, I make more friends and it's going to be a lot of fun because my friend wants to play with me, so I can be part of, whatever the silly game that they are playing. So that's going to be naturally motivating for them to participate. But at the beginning, when we are moving from, okay, now he can do those skills in a contrived therapy setting, how can we make sure the kid starts practicing those skills outside of therapy in a natural environment, maybe with a brand new person, teacher, or friends at school, or in the playground? There have to be a component that somebody facilitate that generalization, and also making sure that practice skills or application is also reinforced or encouraged, so the kids will continue to practice that skills outside of therapy. But like I said, it is intense. It's meant to be intensive short-term therapy. One of our goals for early behavior intervention provider is for parents to feel confident that by the time we discharge our clients, our learners, parents feel confident that, okay, even though I'm not going to have intensive therapy who's going to be working with my child all the time, every day, I feel better taking him to a theme park or a trip or community outing, to those places, without worrying about how am I going to handle if he start throwing a tantrum, or if I need to change my plan last minute. What am I going to do about that? How can I prepare him for those instances, or her for those instances, or how can I react to or respond to that when last minute schedule changes happen, or when the behavior starts happening in that setting? How can I respond so the behavior is going to be manageable and de-escalate quickly, but we want to make sure the parents feel confident about that. Oops, sorry about that weird animation here. Okay, so how do they do it? BCBA typically works during a parent meeting, parent training, caregiver guidance. I think depending on which BCBA you're talking, they might call it in a little bit different way, but we're talking about the same thing, the collaboration, working with the parents together. So how they do it is first, we have to set goals, and the goals that we make, there you go. Goals that we create, we want to make sure those are aligning with the parents' priorities. And also, once we align the priorities and set specific goals, we want to, what the BCBAs typically do is they create a plan. How am I going to get there? How are we going to get there with that child? So parents are able to manage the behavior or facilitate certain skill in a specific environment. Or maybe they can play more with other child, so that more sibling interactions at home, something like that. So the BCBA creates a plan, and for them to implement the plan, what happens is the BCBA cannot be there all the time. So we have to teach parents how they can get there. So maybe I need to teach some very basic fundamental skills so the parents can advance their skill level to be able to obtain a goal. So depending on what the priorities or goals are, BCBA creates plan, and they will teach you step by step to make sure you can get there. And it is important to ask, because depending on what the goals that you guys agree on, BCBA might say, okay, then let's start here. And you might hear that and say, wait. I said I wanted to work on the potty training, or I said I wanted to work on feeding. I want him to be able to feed himself, maybe eat at least same food that rest of the family is eating. So you don't have to make 2 separate meals. So if you are saying that, and then BCBA is like, okay, sounds great. Let me create a plan. All right, starting next week, let me teach you how to take steps towards that goal. And you might be like, I don't get how this is gonna get to that, what I was talking about. You wanna make sure you ask why. Yes, it's a BCBA's responsibility to explain, but sometimes you might not understand, and that is okay. You can ask why and explain to me how you're gonna get there, exactly how what you're thinking, so you don't feel a bit lost from what the BCBAs are working on. And evaluate effectiveness. If the BCBA told you to do certain things at home and you are doing it and you don't see that progress, or you don't see that it's very meaningful, go ahead and let them know. Because that kind of feedback is very important, especially with the COVID. Might not be easy for BCBA to come to your house, or the parents to come to the center, depending on the state or the location, or how comfortable you feel the BCBA feel. But if things that they recommended and it's not working, you have a right to effective treatment. It's not working, you have to let them know. And that's their job. That's our job to figure out how can I make it work. That might require advancing, getting a little consult with more the senior level BCBAs or leadership level BCBAs. Like I get a lot of consultation. My other colleagues get a lot of consultation to support those BCBAs. That happens, or they might try to collaborate with a speech pathologist or occupational therapist, or if it's a feeding issue, they might want to talk to the professional who's expert in feeding related behavior. And also we need to get a clearance from pediatrician, so they can do a general testing to make sure the kid has ability to chew and swallow. So, but without the feedback, they will tell you what to do, and with the best of their ability. But if you don't give them feedback, it might not go anywhere. So it is very important for you to provide feedback so we can adjust and modify. And then, so the last part is so we can make updates, problem solve, and decide what else we need to do, what kind of resources that we need to look into or use, so we can still obtain a goal that we initially talk about. And as you know, the kids grow so fast. If the behavior, if you see a little bit of a behavior that it's going well, we want to work on it very intensively to make sure the behavior keep emerging and want to foster that emerging skills. On the other hand, if you have a behavior that you don't want that to get escalated over time, before it becomes a habit that, oh yeah, he's been doing this last 6 months all the time, before we get to that, okay, he started doing something or she started doing something that I don't really, I don't really, appreciate, or I wish that she or he does something else otherwise. If you start seeing those behaviors, we want to intervene right away, instead of waiting for 6 months, couple of years for the child to always engage in that behavior. And that becomes a bad habit. We all know it's hard to break a bad habit. So earlier the better to intervene those behaviors. And ultimate goals, so after several years of ABA therapy, the child no longer needs us, because they are able to learn from their natural environment, like I said, from kids, from other family members in school. And the child is able to problem solve independently. And the caregiver and parents feel comfortable and confident managing the challenging behaviors. So your priorities matter. Being a caregiver parent of a child with special needs and presents various challenges. And so it is very important for us to know what is working and what is not working. And it is okay. If it's not working for you, you're the mom or the dad or the primary caregiver, it is important for us to know that, because you have to, again, feel confident and comfortable implementing those strategies. And you have to be confident with what we do, so we can expect some generalization outside of therapy setting. It is very important. And some parents, in my experience, are a little hesitant to talk about what they don't like, because they feel like they need to just focus on what's best for the child. But it is okay. Improving overall quality of life, including a child and the family members, are significant factor that we need to consider, especially when you're working with the kids. And also the sustainability of the intervention that we are working, and some treatment targets that we are recommending. We want to make sure those things are meaningful for you, and of course for the child, and but for you too. So examples: playing with siblings. You want to go to the grocery shopping, and sometimes that kind of stuff happens. Nowadays, the curbside pickup is a great lifesaver. It makes it a lot easier, but sometimes you might want to go in the store and then you want to be able to bring your child. So how are you going to do that? Morning or bedtime routine. Things can be a little chaotic, especially in the morning, or the bedtime might always accompany some tears, because they have, that means that no more TV time or cuddles and so forth. But how can we increase their independence and a smooth transition to bed? Feeding issues. Like I said, if you are kind of used to making 2 different meals all the time, we can actually work on that. And so you don't have to do it. Or we do want to definitely respect the child's preferences. If the kid doesn't like it, he tried it, she tried it, they're not, they at least try it, but they decide not to eat it. That's a discussion between BCBA and the parents, how much we want them to eat. But that's something that we can definitely work on, or using utensils. And potty training. I think that's a very popular, common one. So when to share your priorities, those are the things that it might come to your mind that, oh, I really want my child to do this or learn how to do it. Okay, so when can you talk about it? A lot of BCBAs typically provide a biweekly, monthly meeting with them. I used to do a lot of weekly meetings. I meet with the parents, even 30 minutes. Telehealth made that the process a lot easier, but you should be able to request and schedule directly with your BCBA. Hey, can we talk about some recent, my priority or some recent behavioral issues that we observe at home? Can we talk about it? Or the strategies that you recommended last time, it's not working. Can we chat about that? You should be able to directly talk to them, or they might be a scheduler that they want you to mediate, so they can tell you when you can meet with the BCBA and talk. But that should come in easily. You shouldn't have to go through multiple hoops to make that BCBA meeting available or possible. And this is really helpful, even though I've been working as a BCBA over 12, 13 years, getting a little bit of a heads up what they want to talk about. It's definitely helpful, because that will give me enough opportunity to maybe look into a most recent research. So yes, I might have a good amount of experience working on the specific issues that you want to talk about, but that heads up will prompt me to look into the research or double check what I know is up to date. So that will give me a little bit of a time. So I always appreciate a little bit of a heads up. Or I might have enough time to correspond with a speech pathologist or occupational therapist to get their thoughts. So our approach or thoughts are similar, so we can kind of provide a more coordinated care. Oops. So there are a lot of opportunities that what prompts you to talk to BCBA or schedule a BCBA meeting. So recent or new challenges. Or you can also think about what you are going to do in the future, or what you want your child to do, not in general in terms of the skill set, but more of, we have a holiday party coming up, or so he just got invited to a birthday party, and that's in 4 weeks. What can I do? How can I prepare him? Or trip or vacation. Road trip is a common one. What can we do? A lot of kids nowadays love iPad or some kind of screen time, and they are happy for several hours as long as they have an iPad and some snack. Or maybe a plane ride. That's a tricky one. Now you don't have to wear a mask, but how can you make sure the child is able to use headphones so they can just listen to music or video on their headphones, and also sit still for maybe an hour or a little bit more. And staying at the hotel, what to expect, what you can teach now so that changes in their routine is more manageable. It could be a play dates too. You do want to facilitate appropriate social skills outside of a center, and you get to observe it too. Maybe scheduling play date, but how am I going to facilitate that skill so it's not like them playing on this side and another kid is playing on that side? How you can facilitate and maybe build relationship with each other for their kids. And the community outing, going to a playground, library, or some kind of a carnival festival that, that it's loud, a lot of people, what you can do, how you can prepare them. So that requires a little bit of a planning and thinking ahead, but talking to BCBA about some tips and strategies that you can use, it's a very meaningful and helpful way. And BCBA typically really appreciate parents reaching out and for those tips. And a new baby, obviously, when you are expecting, how it's going to be a quite amount of transitions, that how can you prepare your child for additional family member who is coming to your house. And a school, this is a big one. How can I prepare my child to go to school in a group setting, no more one-on-one? What can you do in addition to what the child is already receiving during the ABA therapy? It's something that parents should definitely talk to parents, because that not just related to skill acquisition or generalization, it usually relates to navigating IEP process, how to start corresponding with the parent, with the teachers or the service providers at school, so you know what the child is getting in that environment, what kind of accommodations that they are getting. You might not know all that information, or you might not know who to talk to. The BCBAs are usually a good starting point for those resources. Okay, troubleshooting. So example number one, you don't understand why your child is working on this and not that. When you have something like that, I think I already covered this very briefly earlier. Because of the skills are usually a lot of skills, they are foundational skills, and then more we gradually and systematically advance the target. So the kids are making progress with a lot of successful opportunities. So they feel confident and comfortable, and they're happy. We can probably teach them something in a very using our technique in a manner that very strict, but ABA is all about identifying child's motivation and using that motivation, and we basically condition ourselves as a fun instructor. So what your child is working on at the moment, maybe there's something foundational skills that quite different from what you discussed with the BCBA initially as a ideal long-term goal. So you really want to find out where is this skill going, how that is going, how the BCBA is planning that skill to progress over time. So this is a great opportunity for parents to speak up and ask the question. So this is a second example. You try what BCBA told me, you try something and you're like, okay, well, this is not going to work. Or what they were saying, they might write pretty extended protocol for you to try at home, and you're reading it and you're like, yeah, that's just not going to happen. That it's just not feasible for you because you have other kids and you're working during the day a time, or you have a nanny coming to you, or you have a mother-in-law who's watching a child during the day, and how am I going to tell my mother-in-law to do this and that? So we are going to be on the same page. So you might think of a lot of obstacles or barriers for you to really implement that strategies. You can see how beneficial it could be, but you're like, okay, that's not going to work. That instead of you just giving up and not going to the BCBA, you can say, here are the reasons. If I try this is going to be a problem. And I have a newborn child, and my mother-in-law comes and goes. So these are the really puts a lot of challenges for me to implement that procedures that the BCBA is recommending. How can you help? You definitely have to talk to have that open discussions. Otherwise, we wouldn't know, and we would hope that procedures that they're recommending is implemented and work, obviously. But if you already foresee some problems, then, and I don't want you to go through a lot of challenges and go through a stressful experience. So if you don't think it's gonna work, or if you tried it and it didn't work, please contact the BCBA right away and say, hey, I tried. I don't think it's gonna work. I can even show you a video. I can videotape it, show it to you. Or can you come to my house and watch how that goes and tell me? Or the most important teaching strategies that we do is we say we model for the parents, we model for the children, we model for the behavior technicians how they should be implementing some strategies. We can model. So, okay, if you think this strategy is going to work, can you show it to me? That is very appropriate thing to say, and we will love that feedback. We will love to show that to you. So I highly encourage them to speak up and maybe ask BCBA to show them show the strategies to you directly, so you can see and picture how that works in your life. And a third example, you don't have a flexibility in your schedule to meet with the BCBA on a weekly, bi-weekly, hopefully monthly, but that regular basis. It is also a lot of BCBA's hours, generally speaking, are very flexible. So you really want to ask, okay, just because the center opens from 8 to 5, yes, the meeting obviously is able to, could be scheduled during the office hours, but that doesn't mean that BCBA is not willing to have, late night, so maybe 7:30, like this time for people in the East Coast, to have a little parent meeting, parent training, especially with the telehealth remotely. That is definitely an option. Or maybe on a weekend, maybe not every weekend, but maybe once a month, parent and the BCBA will meet virtually on Sunday at 9 o'clock or Saturday at noon, something like that, what works for you. And really asking BCBA, hey, these are my availability. I can meet this time, that time. Can you make it happen? And if they cannot accommodate, you can really open up the discussion to maybe the center director or scheduler. How can you, because you need that the services to ensure the generalization and also collaboration between home and the center, or during ABA therapy and outside of ABA therapy. We really need that therapy, and we really don't want the caregiver's work schedule to be the barrier to maximize the treatment outcome for the child. Okay, so key takeaways. The caregiver and parent collaboration is key to the best therapy outcome. Caregivers and parents have a right to tell ABA service provider what they're looking for, and also what works and what doesn't work, and share your thoughts of how your child is making progress. We need to hear that. And it is important for caregivers or parents to meet with their BCBAs to provide feedback, share their concerns, and plan for best therapy outcome together. It is not that if the kid is not making progress, we as a team, including parents, we have to work together and problem solve. Obviously, we're professionals, but we need the parents' input to make sure what we do is individualized and makes sense, so the child is able to practice that skills that we are teaching at the center outside of therapy setting. Okay, so this is a reference for this presentation. Okay, well, thank you. This is, that's it for my presentation. I know we have a few minutes. I would love to get any questions or thoughts or some experiences, and maybe I could I could respond to your comments or feedback.
Feel free to unmute yourself if you have any questions, or type it in the chat.
Alexis, I see a question that will this recording be shareable?
Yes, you'll get a link for this after the presentation. It'll get emailed to you.
Awesome. All right, well, if you don't have any additional questions, well, thank you for your attendance and attendance for this presentation. And I will love to, you can probably find my email address on the website, but if you probably reach out to Alexis or Bierman, I will love to have some feedback or any thoughts, questions. I'll be available at any time. So, but thank you for attending. Have a good night.